Cognitive function may decline as a result of certain risk factors such as hypertension, diabetes, elevated cholesterol, and other cardiac diseases. This in turn could adversely impact the physical functioning and quality of life of older adults. The Mini Mental State Exam is a widely used test of cognitive function among the elderly. It includes tests of orientation, attention, memory, language, and visual spatial skills. The MMSE is quick and easy, includes a standard set of only 11 questions, and requires only 5 to 10 minutes to administer. It is useful for both initial and serial measurement. Therefore, you can demonstrate worsening or improvement of cognition over time and with treatment. It concentrates only on cognitive functioning, not on mood or thought processes. It is a valid detector of organic disease. Thus, it is a good screening tool to detect dementia and delirium and to differentiate this from psychiatric mental illness. What are the advantages? It is relatively quick and easy to perform, requires no additional equipment, and can provide a method of monitoring deterioration over time. What are the disadvantages? It is biased against people with poor education due to elements of language and mathematical testing. It is biased against visually impaired. It has limited examination of visual-spatial cognitive ability and poor sensitivity in detecting mild or early dementia. This short lecture will guide you on how to administer this test. Let's start with orientation. Disorientation occurs with delirium and dementia. Orientation is usually lost in this order: first to time, then to place, and to person. In orientation, 1 point is given for each correct answer. For registration, you may say this to your patient: I am going to name 3 objects. After I have said them, I want you to repeat them back to me: apple, table, penny. The number of objects the patient names correctly upon the first repetition determines the score of 0 to 3. If the patient does not repeat all 3 objects the first time, continue saying the names until the patient is able to repeat all 3 items, up to 6 trials. After completing this task, tell the patient, try to remember the words as I will ask for them in a little while. For attention and calculation, ask the patient to begin with 100 and count backwards by sevens. Stop after 5 subtractions. Score the total number of correct answers. If the patient cannot or will not perform the subtraction task, ask the patient to spell the word world backwards. The score is the number of letters in correct order. For recall, you may ask this to your patient: what are the 3 objects I asked you to remember a few moments ago? Items may be repeated in any order, and score the total number of correct answers from 0 to 3. For naming, you may show the patient a wristwatch and ask the patient what it is. Repeat with a pencil. Score 1 point for each correct naming. For this item, instruct the patient. Please repeat the following: no ifs, ands, or buts. As the examiner, enunciate clearly. Include the S at the end of ifs, ands, or buts. If you think the participant heard you but repeated it incorrectly, make a note of what was missed and score 0. Allow only 1 attempt. Give a score of 1 when the participant correctly repeated the phrase. The left side of your screen, highlighted in blue, is an example of a three-stage command. One more common example is this three-stage command. Take this piece of paper in your right hand, fold it in half with both hands, and put it in your lap. Read the full statement before handling the paper to the participant. Do not direct the paper of participant's right side. Hold the paper in front and have the participant reach out to take it. Observe which hand is used. Do not repeat instructions or coach patient. Only repeat if the examiner felt it was not heard or if instructions were not given clearly. For this item, ask the patient, please read the following and do what it says. Hand to the participant the please close your eyes card. The participant may read the sentence out loud. The task to be scored is the participant's ability to follow instructions by closing his or her eyes. It is not necessary for the sentence to be read out loud if the participant performs the function properly. Score 1 point only if the patient actually closes his or her eyes. For this item, give the patient a blank piece of paper and ask him or her to write a sentence for you. Do not dictate a sentence. It should be written spontaneously. The sentence must contain a subject and a verb and make sense. Correct spelling, grammar, and punctuation are not necessary and are not counted as errors. For this item, show the patient the picture of two intersecting pentagons and ask the patient to copy the figure exactly as it is. All 10 angles must be present and 2 must intersect to score 1 point. Ignore tremor and rotation. You may follow this script. Here is a drawing. Please copy the drawing on the same piece of paper. If the participant asks if the figures should be drawn separately or together, the examiner should respond, draw the figures as you see them. Take note of this table on how to interpret the scores. Consider the educational background of your patient when interpreting the results. For the general population, a score of 24 to 30 is interpreted as no cognitive impairment. As a summary, the MMSE is quick and easy and requires only 5 to 10 minutes to administer. It concentrates only on cognitive functioning, not on mood or thought processes. It is a good screening tool to detect dementia and delirium. Always consider patients with poor education due to elements of language and mathematical testing, and patients who have visual and hearing impairment, which is common among our elderly patients.